Hello, my name is Dr. Jody Cahill. I'm a homeopathic doctor, naturopath, and homotoxicologist. But today, I want to speak to you about managing allergies using a holistic paradigm. How can we manage allergies? And that's what we'll be exploring today. But first, there are different types of allergies. So, for those who haven't come across allergies before, perhaps this is going to be a new exposure to what allergies are all about. But I think probably a vast majority of you listening have either an allergy yourself or perhaps have a loved one that has an allergy or perhaps even multiple allergies. So first things first, allergies are classed as what we call atopic conditions. So you may have come across this term before. We have things like eczema or atopic dermatitis. We have hay fever, asthma, and then really more extreme scenarios of anaphylaxis. Now, you may have come across something called the atopic triad. And what the atopic triad is a triangle or atopic triangle of collective atopic conditions. So we have eczema at the top, hay fever, and asthma. And the reason why they put this into a triad is because you often find that within either families or within an individual, they often have, if not all, multiple atopic conditions. Now, at the bottom left of your screen, you'll see a little box titled the Allergic March, also known as the Atopic March. Now, you see very typically in individuals' kind of life stories, developments of eczema at a very early age, a very young age. So, normally either from the point of birth or a little bit later on as they start weaning. Little ones that develop eczema typically then go on to develop then food allergies and significant food allergies, which I'll explore in a moment. From there, they develop rhinitis or hay fever, and from there, potentially, then also developing asthma. Now, what you often find is that once an individual kind of moves along this atopic march, once they develop something like asthma, the eczema and rhinitis start subsiding, or perhaps maybe the eczema is completely resolved, but actually what we're seeing is that we're essentially expressing this atopic condition or disease in deeper, more vital organs. And we see this in naturopathy and homeopathy. We talk about where the body chooses to kind of manifest diseases. When we see the lungs being affected, this is a more kind of vital organ or tissue. And so, as part of the healing process, very often what can happen is we tend to move the patient in the reverse of the allergic or atopic march. So, unfortunately, we end up seeing a lot of patients once they've already had asthma and they've been treating asthma allopathically for a number of years. And what will happen during the treatment process is that we generally will start kind of uncovering, and perhaps as we start improving their asthma, all of a sudden they notice, oh, their hay fever's come back and they haven't had hay fever for the last 10 years. And as we start kind of treating the hay fever and the hay fever gets better, all of a sudden they've got eczema and they'll say, my gosh, the last time I had eczema I was a child. And this is part of the process of kind of reversing the disease state or disease progression. So eczema is classed as a more kind of superficial version of atopic conditions, whereas asthma is a more deep, more serious, more concerning atopic condition. And then, of course, the more extreme forms of anaphylaxis, these are situations where the individuals have hypersensitivity reactions that are so extreme as to potentially close the airways and inhibit breathing. So some interesting statistics for the UK. The first one here, the UK has one of the highest prevalences of asthma, rhinitis, and eczema in the world. In the world. This is not Europe. This is in the world. Over 20% of the UK population is affected by one or more allergic disorders. And in the 20 years leading to 2012, there was a 615% increase in the rate of hospital admissions for anaphylaxis in the UK. Now, remember that anaphylaxis was the most extreme form of atopy, where we have closure of the airways. This is a medical emergency, a 615% increase. Now, these are just a few little statistics. But really, when we start looking at these levels, and allergies and atopic conditions are on an ever increasing incline, we really need to question, what in the world are we doing? Why are we developing such an extensive hypersensitivity response to what should be normal foreign substances? So what is actually going on in an allergy? So to try and simplify it and help you understand both what's going on in your bodies when you develop allergies, but also why do doctors, why do they choose certain medications to treat these allergies? So first things first, allergies are hypersensitivity reactions. And what we mean by this is that we're seeing the body over respond. We have a hypersensitive response, an over exaggerated response to a foreign substance, or also known as an antigen. Now, an antigen is a protein. It's a protein that is found on the cell membrane of all living substances. So this, whether this is a pollen, whether this is a dander, so a bit of cat fur or dog fur or horse fur, whether this is dust. So dust can be both an irritant but also an allergen. An allergen, in other words, a substance that induces an allergic response. So really, these antigens or foreign substances are substances that we all encounter on a daily basis. But of course, in some individuals that have atopic sensitivity, they create these exaggerated responses to these substances. And so very common ones are things like pollen and dust, particularly now this time of year. We start seeing, in April, May time, we start seeing pollens and grasses really flaring a lot of people up, particularly with their hay fever. Dust can be a typical kind of all year round allergen. And then eggs and peanuts. Dairy could be another one. But what we're seeing in common with all these patients, irrespective of whether they have eczema, hay fever, or asthma, what they all share in common within this atopic body is an elevated IgE. Now, IgE is a type of antibody, and we find that particularly within families where there are a lot of allergies that run through the family, we tend to find that there's an IgE dominance that seems to run through the family. So there's almost kind of like a genetic inheritance of elevated IgE. Now, what happens is that these IgE antibodies attach to a little cell called a mast cell. Now, the mast cell it plays an important role in kind of regulating inflammation within the body. Inflammation is not all bad. Lots of people believe or view inflammation to be a bad or unhealthy process. And quite contrary, inflammation is pretty essential to healing. But when inflammation is perpetuated and goes beyond its application and healing, it starts then becoming destructive. And so that's really when we need to kind of step in. But prior to that, inflammation is hugely beneficial to the healing process and the immune response. So anyway, getting back to the IgE. So what happens in individuals who have these hypersensitive reactions? They produce a high level of IgE, let's say to pollen. But as these IgEs are being released to the pollen, the IgE attaches to these lovely little cells called the mast cells. And when IgE attaches to the mast cell, it causes the mast cell to become a little bit irritated and undergoes a process of what we call degranulation. In other words, it releases these chemicals. And so we have these surge of chemicals running through our body, one of them being histamine. Now, there are a multitude of different chemicals. Histamine is the more dominant one, but we have other substances like heparin and leukotrienes. Leukotrienes I'll come back to in a moment. Now, what histamine tends to do is it causes a massive surge in inflammation. Now, of course, this depends on the location of release of the histamine. It doesn't necessarily mean that it's released systemically. It could just be a localized release of histamine. But in essence, histamine's job is to kind of widen the motorway, so to speak. So it dilates the blood vessels. And by doing so, it allows more blood supply to rush into the area where we have this potential threat. Remember, the body thinks it's under threat. Yeah, that's why it's having this exaggerated response. It thinks that the pollen is potentially threatening the survival of the organism. And so the histamine is causing this increased blood flow to the area. And as we increase blood flow, we have swelling of the tissues in the area. We have redness, we have heat, and sometimes the swelling can be so excessive as to cause significant and persistent pain. So some of you who've had allergies can appreciate some of these processes that are occurring in the body. So typically from an allopathic stance, how allergies are normally kind of treated or managed is through a variety of different drugs, depending on the severity, depending on the type of condition, depending on how regular the individual is suffering from the symptoms of allergy. So the first one is antihistamines. Now, antihistamines are often given either orally. They can be given topically in certain situations. They can be given via injection. They can be given as nasal sprays. Corticosteroids are normally utilized as a prevention rather than a treatment. So if you have individuals who suffer from hay fever, they may get onto a corticosteroid before their symptoms develop. You see this also in asthmatics using corticosteroid pumps as a preventer. So it prevents them having hyperreactive airways. But in situations where the airways are responding acutely, things like bronchodilators are more applicable in those situations. So bronchodilators are inhalers that help kind of widen the airways. We've got another type of drug called a leukotriene antagonist. Now, examples of these are things like montelukast and Singulair. And these were found to be useful in patients who, it wasn't appropriate to put them onto corticosteroids. And you often find this is the case for children. When children are being treated with things like bronchodilators and they're just not responding as well as they should, and they've got quite persistent asthma, it's not ideal to put children onto corticosteroid preventer pumps. The reason for this is although it's supposedly localized, corticosteroids in reality are never localized. These are fat-soluble substances, so they actually move through body membranes quite readily. And so it's not ideal to put little ones onto corticosteroids because it can inhibit growth, it can compromise their immune system, it can disrupt hormonal production. So, ideally what they started doing is kind of giving children leukotriene antagonists that were non-responsive to things like bronchodilators or antihistamines. And the leukotriene antagonists work very similarly to an antihistamine. It just works with a different chemical. So where an antihistamine is blocking the histamine, leukotriene antagonists are blocking leukotrienes, which is another kind of inflammatory molecule. Some patients use something called immunotherapy, and this is quite often used for things like hay fever. Immunotherapy often involves a kind of program where individuals are injected with the foreign antigen that they're allergic to in a controlled setting. And the point of the immunotherapy is to force a kind of desensitization to the allergen. So if it was to Timothy grass, for example, then in time, what they are hoping is that the individual will downregulate their sensitivity to Timothy grass over a course of treatments. And then the last one, EpiPens. EpiPens are adrenaline injections. So these are used in cases where patients progress pretty quickly to the into the anaphylactic type reactions. So in this situation, you often find patients that carry EpiPens with them have had historical anaphylactic reactions in the past. And unfortunately, once you've had one anaphylaxis, you're likely to have others if you encounter that allergen again. So they will be required to carry an EpiPen around with them for the rest of their lives. They also need to have an allergy bracelet so that people are aware that they are allergic in case they do ever have an episode and they lose consciousness. All right, and then also there are other drugs that are used for the complications of allergy. So you often find, particularly with patients that are on long-term corticosteroids, I see this a lot with asthmatic patients where they tend to then, because they're taking a corticosteroid pump, they tend to, unfortunately, develop a kind of compromised immune response because of the effect of the steroids. The steroid job is to reduce inflammation, but sadly, it also decreases the immune response. And so these individuals often end up picking up chest infections, and so generally need repetitive courses of antibiotics through the year. You may find sometimes too that they may need antifungals because unfortunately corticosteroids, as I've said, because it compromises the immune system, you often find these individuals, if they're taking any kind of corticosteroid oral pumps, they can sometimes develop oral thrush in response to that. So they may also need antifungals as well as antibiotics. And it becomes a bit of a vicious cycle. But anti-inflammatories are also ones that may come about as a result of complication of allergies. So generally, if the antihistamines aren't quite working well enough and there's significant amounts of swelling and pain around the tissue area, they may be given things like ibuprofen or naproxen. But again, I mean, these are not ideal, particularly that they're not great for the kidneys, they're not great for the stomach lining. So they do come with a whole host of side effects too, which are not great, particularly when considering atopic conditions tend to be chronic conditions. These are not acute episodic conditions. These are conditions that normally require lifelong management, and thus then sadly, if they fall into the system of allopathic medication, it ends up being a system of lifelong allopathic drug use. So a question I get asked all too frequently is, why are allergies so prevalent and why are they continuously increasing? Why are so many children being born with eczema, not only developing eczema later on in life, but being born having eczema? Why are we having young kiddies as young as 3, 4 developing asthma and being diagnosed as having asthma? We really need to question the environment that our children, these new generations are kind of growing up in. And I think it would be unfair to isolate one particular cause. I really think it's a kind of multi-dimensional issue that we need to tackle and approach. So the first one I want us to consider here is the air pollution issue. And I put a little picture on the side here because I thought it was quite remarkable to see the impact that as humans we have on our environment. The top picture is showing us London on an average day, and you can barely see the outlines of the buildings there. So that's because of the intense air pollution around the City of London. And the bottom picture is a picture of the City of London while London was in lockdown during the COVID pandemic. And it's quite remarkable when you look at the clarity in the sky, whilst there is limited transport, limited human access. So hopefully you can just get an appreciation for the impact that just, motor vehicles and transport and aeroplanes and all what are these, these impacts they're having on our environment. And I want to draw your attention to, because we tend to think that it's just urban areas that have high levels of air pollution. And this is far from the truth. We're seeing more and more rural areas being just as heavily polluted as urban areas. We must be reminded that in rural areas, we have a high exposure of pesticides and insecticides, particularly if we're in areas where there's a significant amounts of crop spraying. And so I've been fortunate enough to see patients in both different kind of environments, both in urban areas and rural areas, and the exposures of heavy metals in these patients are different, but are still heavy metals nonetheless. Yeah, so where in kind of urban environments, I tend to see more cadmium and copper exposure. Interestingly, in the rural areas, I see a lot of lead as well as aluminium. And this comes from the insecticides, pesticides, and very often in these kind of old rural homes and farmhouses, there's still lead pipes evident. In terms of indoor living, so I want to draw our attention to the indoor living issue. And I think this is really fascinating and an area that's not explored enough. As we've evolved and as we've moved into homes and we have lovely central heating, we've created another little kind of micro environment in our indoor living spaces that has essentially created breeding grounds for a variety of molds. And molds, unfortunately, although they prefer not to be indoors, we create a beautiful environment that's warm, it's moist, and it's quite conducive to their growth. And so when you're looking at homes that have carpeting, curtains, sometimes in quite severe cases, you may find patients, if they're not rotating their mattresses, they have colonies of mold underneath mattresses. Um, and unfortunately, these pollute the environment. Mold spores, unfortunately, when they're inhaled into the lungs and breathed into the sinuses, can create colonies of mold within the sinuses. And I've found really 80% of chronic sinusitis infections tend to be associated with mold. And it's quite ironic because what are most sinusitis infections treated with? Antibiotics, typically, and corticosteroids. And unfortunately, antibiotics do not kill the mold. And if anything, they change or alter the nasal microbiome, which just actually facilitates that mold growth even more. And in addition to that, corticosteroid nasal sprays compromise the immune system's response, which means the patient doesn't have an immune system to fight that mold infection anyway. So you tend to find that as these molds kind of grow and colonize within the different sinus areas, they become more and more tricky to treat. And they're really on an ongoing uh, 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 basis, they tend to deplete the immune responses of those individuals. So those individuals generally tend to get colds and flus quite readily. And you hear patients often saying, the moment I get a cold, it goes straight to my chest. Now, these are typical indicators of a mold issue. And so I always try and urge patients to, just have a brief kind of observation of their living spaces. Have a look at their bathrooms. Do they have, look underneath kind of toilet piping, basins, inside cupboards, look at behind curtains, look under your mattresses, look under your couches. If you've got carpeted flooring, you have mold, no doubt. Yeah, if you live in the UK or if you live in a cold environment that has central heating, you have mold spores in those carpets. And unfortunately, those spores will be released into the air and you will breathe them in, and they will have some kind of knock-on effect with your immune system. So do have a look into that. Another angle that comes up into discussion is this whole idea of the hygiene hypothesis. This idea that as we've kind of modernized, we've become more aware of hygiene habits, and actually we've gone to the extreme of kind of antibacterialing everything. And unfortunately, because we've become so germophobic, we've created an environment that's kind of over sterile, particularly for an infant and a toddler that is exploring their environment. It's I always find it interesting to reflect on. We're probably one of the only species that carry, or at least that have young that cannot walk straight away. Most of the species have young that can walk and mobilize themselves pretty much straight away. So it's quite an interesting one, and perhaps maybe there's a reason, there's some kind of um, evolutionary purpose in having human offspring, that one needs to be attached to mum for a period of time while they breastfeed. But once they develop a healthier immune response, they start developing their own immune system, normally around about 6 months, they're now starting to get ready to kind of wean. And with weaning comes an exposure to a whole new cocktail of foreign antigens. And once they start weaning, they start sitting upright. They then kind of move into the next milestone of mobilizing themselves, so starting to crawl. And with that starting to crawl, they're putting things in their mouth, they're touching things they shouldn't be touching. But the whole point of that is to try and inoculate their gut and expose their gut to a variety of different bacteria. And this is something that I don't think we talk about enough. Although, microbiomes and gut microbiomes is if you're into health and in reading health books, we talk about probiotics so extensively. But we have an array of bacteria in our environment that we can expose ourselves to. Look, I'm not saying we don't need to all be slobs and have mud all over the place, but I do think it's important for children to come into contact with animals, to play outside on the grass, to get muddy, to chew on a stick every now and then if they're going to chew on a stick, obviously with supervision, but to be kids essentially. And I think this is something that we need to be mindful of. All right, the other angle to consider is the lack of vitamin D. Now, there's loads of studies that have explored this idea of, particularly with autoimmune conditions as well as atopic conditions, of why they seem to be so prevalent within the Northern Hemisphere. And one of the angles that we explore quite significantly is this lack of vitamin D. And I will say, from my own personal clinical experience, lack of vitamin D is pretty rife, particularly within those atopic individuals. And so, generally speaking, if you live in the Northern Hemisphere, it's probably advisable anyway to do regular top ups of vitamin D. The discussion of premature and delayed weaning. So, there seems to be, this is an uncertain terrain. So, I've suggested that perhaps maybe premature weaning could be a cause. I've suggested maybe delayed weaning could be a cause. So where is the right time? What is the right time to engage in weaning? And the sad thing is that there is no right time, but I think what is important is not so much when are we weaning our infants, but rather what are we weaning them with. So of course, infants generally will show indicators or signs that they're ready to eat. So things like attempting to reach out and grab food, the fact that they've developed the motor skill of putting things in their mouth. Generally, these are indicators that weaning is ready. Yeah, that they're interested in food. So I think, although the NHS advise 6 months, I do think that some babies are ready at 4.5 months. Some babies are only ready at 7 months. Yeah, so I equally don't think it's advisable to force a baby into weaning if they're not showing the indicators of being ready to wean. And the reason why I say this is that I think that there's potentially a linkage between whether or not their gut is ready to accept or tolerate food. So if you too prematurely kind of shove food into their mouths when they're not ready, this could possibly be linked with that whole kind of idea of premature weaning. So giving them food when they're not ready. And so going back to my angle of what are we weaning them with? Here comes in the topic of kind of poor diets. Are poor diets contributing possibly to allergies? So many countries, the first foods that little ones are weaned onto generally tend to be grains. And unfortunately, it's often the grains that generally set up the terrain for cross-reactivity, for what we call molecular mimicry. And in molecular mimicry, we have a kind of cross-reactivity between the immune system attacking the grain, but while it's doing so, also attacking our gut lining. So there's a bit of a gray area with this one. Most certainly what I recommend to my own patients and what I did with my two children was rather to wean onto vegetables first. So things like pureed carrots and parsnip and then you start doing your blends of vegetables and fruit. And yeah, I generally, if one can, avoid giving grains until about 10, 11 months. And in some cases, 12 months, depending on that little one's kind of family history. But also the angle of poor diet, looking at quality of food. So unfortunately, Europe's been fantastic in obviously kind of being very strict in avoidance of GMO. But now we've had Brexit in the UK, and in places like in the US where GMO is extensively available. Unfortunately, it's likely that the UK is probably going to move into having GMO produce on our shelves, and so we may possibly start seeing that this too is going to have a bit of an impact in terms of immune regulation, development of allergies and autoimmune conditions. Foods that are highly processed. So if you've looked, if mum's been on, was eating lots of highly processed foods during pregnancy, unfortunately, we're taking food away from its natural state. And so when we take it away from its natural state and we process it and modify it, unfortunately, the body doesn't tend to recognize those molecules as well as they should do. And this could potentially also have an impact. Also having non-organic food. It's not just from the GMO stance, but having non-organic food is often laden too with heavy metals, with insecticides, pesticides, and this can also have a bit of a overwhelming impact on immune modulation. So it can sometimes incite inappropriate immune responses in certain situations. There's some studies looking at possibly the exposure to paracetamol, so in other words, things like Calpol in infancy. So when little ones get fever, perhaps kind of overusing paracetamol, regular usage of antibiotics. It's really incredibly sad. I mean, you're often finding, particularly in this country, and I'm from South Africa. In South Africa, you find little ones, having 3-4 courses of antibiotics per year. In some cases, little ones are born and put onto IV antibiotics in order to keep birth infection rates low. So it's pretty overwhelming when you look at how neglectfully antibiotics have been prescribed. And then, of course, the angle of vaccination. So this is not only looking from vaccinations with regards to the introduction of foreign antigens into the little one, but also from the adjuvants, so the other additional chemicals which we have in vaccines. So the issue around vaccines is kind of two-part or twofold. We're looking both at the variable antigens within the vaccine, but also the variable vaccine adjuvants, the additional things like formaldehyde, aluminium, antibiotics, all of these other chemicals. Heavy metal toxicity also is one that we need to consider, particularly if you live in urban areas, as I've said. So that kind of links back up to the air pollution, but we need to also be mindful of heavy metal toxicity, not only in the air that we breathe, but also in our water supply, in our foods, and what we're cooking with and what we're eating. And then the last one, radio waves. And I think, there's more and more studies that are coming out looking at the impact that radio waves have on our cell biology. So it's looking at the impact that radio waves have on things like protein synthesis. So this is like the workings of the inside of the cell. And there was a number of studies that have been conducted of looking at how radio waves impact on part of our immune system called the T cells and how they behave. But again, more studies need to be conducted. And of course, as we progress in our technology, we really need to kind of engage in a lot more studies in this. But hopefully this gives you a bit of a taster of the various different environmental and lifestyle choices that could be impacting on an individual's propensity to develop allergies. All right, and so we're going to explore a few kind of natural approaches. And of course, this talk is mostly looking at what can you do homeopathically to help support individuals who have allergies. But always, the best place to start with preventing allergies starts preconception. And so when you're looking at individuals that have family histories of allergies and they're wanting to start a family, we're really looking at trying to kind of alter that individual's microbiome and try and correct that high level of IgE in those first 3 months prior to conception. Then, of course, during pregnancy, we'd like to maintain that. So supporting the individual, perhaps look at if they have high levels of IgE, what could be mediating their high levels of IgE? Is it dairy? Is it eggs? Is it tomatoes? Is it strawberries? And obviously trying to look at kind of down-regulating those, but also modulating their immune response. Looking at during lactation. Now, we do know that with infants, when they are being breastfed, they do get an antibody called IgA antibodies from mum. Now, those IgA antibodies are vitally important for that infant's microbiome development. IgA in the gut helps the gut uh, um, decide. I kind of liken IgA to like the gardener of the gut. Okay, so when we have certain bacteria that are a little bit too much, the IgA helps kind of tag them and allows the immune system to kind of eliminate them. So IgA is kind of like the regulator or the maintainer of the gut microbiome. And so the little one, that little infant, is gaining that little gardener, that little maintainer from mum during the lactation years, or not years, sorry, months. And then as we encroach into weaning, I've really explored, when is the right time? There is no exact right time. Again, mum needs to be mindful of baby's behavior, but it's more the choices that we choose to wean our infants on. So as I've said, I generally prefer to advise individuals to wean their little ones onto vegetables first, and after a period of time onto fruit. But yeah, vegetables, and then adding things like bone broth to the vegetables, adding ghee and lipids, essential fatty acids to them. They do not need grains. However, I will say that I would advise not to avoid grains completely unless there's a family history of things like celiacs where you may be a little bit concerned about introducing grains. But as a whole, it's best to try and get the little one exposed to a variety of allergens. But what I'm saying is don't let the grain be the first food they get introduced to. Rather, start it off with vegetables, then fruits, then they can introduce to meats, and then grains. So grains should be the last food introduction. The fifth point here is ongoing diet and nutrition intervention. So it doesn't necessarily mean that they have to be on supplements for the rest of their lives, but you may find that during periods of heightened sensitivity reactions, they may need to support themselves a little bit more than that they would in another time of year. Sometimes you may find these patients, when they're coming to see you, or perhaps you yourselves, you're already on allopathic medication. So you may need a period of time where there's a kind of handover. So while you're taking your allopathic medication and slowly trying to reduce them, so you're also doing dietary and nutritional modification. Ideally, also avoiding antibiotics if at all possible. Thankfully, within the realms of complementary medicine, there are multitudes of tools in therapist boxes. So, whether it's herbs, whether it's homeopathy, there are fantastic nutritional supports too, that very often you can avoid going down the route of needing antibiotics. But the point is, there needs to be management early on, not when it's too late. And unfortunately, in many cases, we end up seeing patients when it's too advanced, it's too late. Yeah. Although it's never too late to stop modifying, but the reality is that, when patients are seeing us when they've been on multiple courses of antibiotics, it takes us a little bit longer to kind of reverse all that damage. All right, and then the last one is just being aware of the environmental exposures and try and limit those environmental exposures as much as possible. So as I said earlier, particularly when it comes to air pollution, are there possible things that you could be changing both at home, so making sure, that you have windows open, you've got some fresh air, particularly to try and kind of reduce or limit mold colonization in your living environment. But also things like walking on the sidewalk, making sure that you're not walking right up against the road. Try and step as far away from the road as possible. It was a fantastic book by Tim Smedley, which I've put here for you, called Clearing the Air. It was amazing how he highlighted, of course, the impact that air pollution has on health. But not only that, he also has some really kind of useful top tips on how to limit exposure, and also to try and kind of improve air quality in your environment. So I do highly recommend that as a good read. All right, and from a natural kind of stance, although I'm not going to go into detail in terms of the dietary supplements and the herbs that one could use, but generally speaking, these are good kind of additional supports that one could kind of add into their protocol. So vitamin A is fantastic, particularly with atopic conditions. So whether you're looking at an eczema, hay fever, allergies, so kind of allergic asthma. Whenever we look at something impacting on the mucosa, so keeping the mucosal membranes nice and healthy, vitamin A is kind of like the go-to vitamin. It keeps mucosa nice and healthy. It also helps improve the immune response. Vitamin D, I spoke about earlier on, I think is always a great combo anyway, particularly if you live in the Northern Hemisphere. Then we have zinc. Zinc is also a well-known kind of immune mineral, but it does have a great role to play, particularly within skin health. So although I would probably recommend anyway zinc to any atopic individual, but more so in someone with eczema. And then quercetin. So quercetin is an interesting one. This one is a really useful one that helps kind of maintain or support the mast cell membrane. So if you remember a little bit earlier on, I mentioned how the IgE antibodies attach to the mast cell membrane and cause that mast cell to release histamine. Now, quercetin helps to stabilize, much like how things like vitamin C also help stabilize that mast cell. And by doing so, it reduces the amount of histamine that those mast cells produce or release. So I'd highly recommend something like quercetin. It's always useful to get onto quercetin at least about a month before, particularly things like hay fever. So at least a month before you're likely to develop hay fever signs. So if you know that, right, generally the beginning of April is my time to develop hay fever symptoms, well then you'd probably best start in the early March. And then we've got the last one, essential fatty acids. So essential fatty acids, particularly those with high EPA levels, this is a great anti-inflammatory. So if you remember me mentioning how in allergies, we tend to have this histamine surge, which causes a lot of inflammation, a lot of swelling. Now, the EPA helps reduce some of that inflammation, and so helps facilitate kind of drainage and lessen the severity of symptoms. Now, there's a number of herbs that can equally be as useful. So nettle or stinging nettle is a fantastic one. And I mean, it grows everywhere. It's like a weed in the UK. But it's a fantastic one to help stimulate drainage. It also, it's known as Urtica urens or Urtica dioica. And in homeopathy, we actually use nettle, called Urtica urens, for things like urticaria or hives. And if you just think of if you had to brush your leg up against a patch of stinging nettle, what kind of skin reaction do you get? And in homeopathy, we use it to treat urticaria or hives. Then there's another one, butterbur. Butterbur is fantastic, particularly for hay fever. You can take it as you've got hay fever symptoms, but again, these generally tend to be better taken about a week or two before symptoms start developing. Euphrasia is a useful one too, in that I will talk about it actually in the homeopathic stance. From a homeopathic perspective, it's been prepared homeopathically, but in this situation, it is the raw material euphrasia. And it's a fantastic one for hay fever, for watery, scratchy eyes. It's a really commonly used, particularly with eye baths. And then we have astragalus. Astragalus is brilliant, particularly also for asthmatics, because you find asthmatics, particularly if they're being treated for kind of chronic asthma where they're needing long-term corticosteroids, you often find that they're quite susceptible to chest infections. Now, astragalus is brilliant at reducing the likelihood of them getting the chest infection. But what I will stress is that once they have a chest infection, it's best not to give them astragalus. So you'd rather give them something like reishi or echinacea if they develop a chest infection, or golden seal. Astragalus is really more used as a preventer rather than an actual treatment. And then reishi, which is a mushroom, is a brilliant immune modulator, and that it's been one of the most, I mean, there's loads of different mushrooms, but it's probably one of the most researched within the realms of atopic conditions. So hopefully that gives you a bit of a background of some of the kind of nutritional and herbal approaches and things that you may want to do a bit of background reading on. But I want to talk to you about the homeopathic angle. What can you do with homeopathy to help kind of manage allergies? So first things first is, why even consider homeopathy as a form of treatment or management? And my first response always is because homeopathy develops the immune resilience. So it's not about stopping an individual from getting sick. It's not about stopping someone from getting a cold. But what we're hoping here is that we develop better immune modulation, a better immune resilience, so that when an individual does get ill, they recover quicker, and also they have the condition for a shorter period of time. And so, all in all, that shows our capacity to cope with or tolerate foreign antigens that much better. And so, we see within the realms of allergies, the patient either may still have the allergy, but their symptoms are, instead of being, extreme 8 out of 10, are now only at 2 out of 10, and far more manageable and less disruptive to one's lifestyle. The other angle too is that homeopathy is therapeutically effective, and I'm going to show you a few studies showing you how homeopathy is therapeutically effective in the treatment of atopic conditions. Homeopathy is also incredibly safe. It's a low-dose medicine, so there's no risk of interacting with pharmaceutical drugs. There's no risk when taken alongside pregnancy. It's safe to give in infants. So it's an incredibly kind of versatile and all-rounder for really anyone to utilize. It doesn't matter your age or what medications you're on. It's also incredibly cost effective. Homeopathy is not an expensive form of medicine. Of course, seeing a qualified homeopath can be pricey, but I'm hoping that by giving you a couple of tools or indicators of what kinds of remedies you could use, try them out on yourself, try them at home. You're not going to make yourself worse by taking them. If they're not the right remedy, you just won't feel better. Yeah. So if you don't feel better, stop taking it. It's not working for you. So it is incredibly cost effective and pretty safe to try out without being advised in detail. It's also pretty readily accessible. So there's a variety of different homeopathic pharmacies that you can get access to homeopathic remedies. You can also buy 30C potencies on Amazon pretty easily. So for the masses, it's generally readily available unless you're dealing with more kind of ongoing chronic conditions where some of these things that I've suggested to you, you may not see a result from. And so thus then you would need to seek obviously more detailed advice, because unfortunately homeopathy isn't an easy science and art form. It does require sometimes a professional homeopath to advise you. All right, so this here I thought was a brilliant study, just showing the evidence of immune resilience that develops in patients that were treated for atopic diseases. Now, this study was not conducted specific to eczema or hay fever or asthma. It was just 325 pediatric patients with atopic diseases, most of which would have had eczema. Now, 75.8% of atopic patients had a moderate or major improvement during the treatment. 107 patients visited between 1998 and 2006. They were revalued after a mean length period of 7.4 years. And so this is quite an extensive trial period. And 75 out of 107, so in other words, 70.1% of patients with long-term follow-up showed complete remission. So there's no resurgence or evidence of an atopic march. So if you remember that slide I showed you earlier on, talking about how you find little ones kind of progress through this atopic march where they develop eczema when they're very little. That then progresses into food allergies, which then progresses into hay fever, which then progresses into asthma. We didn't see this developing in these individuals. And so this is showing us our capacity that even when we have an inherited or genetic predisposition to atopic conditions, that we have the capacity to stop that process progressing, in the next generation. So I think that's remarkable. The other angle is homeopathy is better than placebo in hay fever. And so here, what they did was they showed a model or a double-blind placebo-controlled trial of comparing homeopathic treatment to placebo. And beautifully, they showed that there seemed to be a response in patients receiving the potency, but not in those that received the placebo. And so this was at least highlighting that the homeopathic medication that was utilized in these patients with atopic conditions worked better than placebo. So there must have been something within that homeopathy. And then lastly, homeopathy in ENT, ear, nose, and throat, and pulmonary allergies. So this one is not specific. So unfortunately with homeopathy, because homeopathy is based on more kind of individualized prescriptions, so we don't have, I've given you some examples of 6 hay fever remedies, but unfortunately it's not as easy as that. Sometimes, particularly in chronic conditions, you need more kind of deeper acting constitutional remedies. And so what they did here was they looked at cases that had ear, nose, and throat conditions, but a vast majority of these patients that they explored had more kind of deeper pulmonary tract allergies, i.e. asthma. And most of them were treated with 3 common constitutional homeopathic remedies, all being Lycopodium, Pulsatilla, and sulfur. But 31 cases of respiratory allergies consulted only once, and the reason for such a state had been reviewed. If all these cases were therapeutic failures, the success rate of the homeopathic treatment is 87.6%. So of the patients that they saw that were treated with homeopathic constitutional remedies, 87.6% of these patients had success in management of their respiratory allergies, which again is remarkable. All right, so there's a number of different homeopathic approaches. If you have seen a homeopath before, perhaps maybe you recognize some of these approaches. There is an approach of desensitization. So similarly to the immunotherapy that I mentioned earlier on, this is a process where homeopaths give what we call a no-sode. And so if a patient knows that they are allergic to Timothy grass, then what the homeopath would do is would give them Timothy grass in a homeopathic form. So in other words, in a homeopathic dilution. Normally either in a 30C or a 200C for a period of time. And this kind of works to kind of desensitize their immune response. And you can do this for a variety of different allergens. So that could be grasses, it could be pollens, it could be drugs if they've got an anti-inflammatory allergy. It could be for egg, it could be for glutens, it could be for cat dander or horse dander. So really, whatever that patient is allergic to, we can produce it in a no-sode form. And generally, the rule of thumb is if you're administering it in a 30C potency, that 30C would be given 2 to 3 times a day, depending on the severity of the patient's symptoms. Or if they didn't have symptoms yet and we're wanting to kind of use it prophylactically because they know that, in April they're going to start manifesting signs of symptoms, then you could start a month prior to April. So beginning March, you may start taking a 200C of that no-sode once a week to reduce the severity of the symptoms when they do come on. Then there's, of course, the acute management. So these are acute prescriptions based on the presentation of symptoms at the time of having the asthma. So these are not used kind of prophylactically as the desensitization approach is used. These are used as and when the symptoms manifest. Now, generally speaking, also, if you were administering a 30C, this would be given 3 times a day. If it was weekly, it would be at 200C once or twice daily for up to 3 days. If after those 3 days you're not seeing any improvement, then generally the rule of thumb is it's not the right remedy. You need to figure out what the right remedy is. Homeopathy is incredibly potent, so you should be seeing a response. It may not be a complete resolution of symptoms, but you should be seeing the body respond appropriately by lessening the severity of the symptoms. And then, of course, in terms of chronic management, I mean, ideally, all of these conditions really, particularly eczema and asthma, generally tend to be chronic conditions, and so really need an ongoing supervisory support. So I would suggest then perhaps looking at a qualified homeopath to advise you further. Okay, so let's have a look at some remedies in eczema. So the first remedy here we see is Serinum. Now, Serinum is how the patient presents in terms of their eczema. Generally, the eruptions, they tend to get infected really easily. So when they scratch, they suppurate. In other words, they produce kind of like a pus, or they weep very easily. They tend to also get worse at night. And so you find the individuals that develop these eczemas that require Serinum, they tend to be worse in bed at night, particularly if they feel too hot in bed, and equally if they feel too cold. So it's both too hot and too cold. So temperature extremes tend to aggravate their eczema. They also tend to be worse in winter. So the eczemas, they may have kind of annual eczema, but tends to obviously get worse during winter times, and particularly bathing. So bathing tends to kind of flare the eczema up and gets very hot, very red, and very painful after bathing. Interestingly, though, although they get aggravated by being hot in bed, if they have a patch that is incredibly itchy and painful, normally something like a warm compress on the area tends to provide a bit of relief from the itch. And this makes it quite different to sulfur. So sulfur is the second remedy I'll suggest here. And sulfur is probably one of the most commonly used remedies for eczemas, and in fact actually with all the atopies. So sulfur is used quite a lot both with eczemas, hay fever and asthma. We often describe the eczema of a sulfur patient as a kind of voluptuous, pleasurable itch. You know, so you see these like little ones, they'll be scratching themselves and they look like they're in absolute bliss while they're scratching. But unfortunately, they scratch and scratch and scratch until they raw, and they often bleed with the itching. Right. So they seem to have kind of no self-control over the degree at which they scratch. Now, they also tend to be worse at night, and very specifically, they're very sensitive to wool, so the kind of touch of wool on their eczema skin. They're also worse with becoming heated, whether this is through exercise. So you find these are the ones, you know, they'll go play outside and they're running and running, and they'll come inside and they, you know, with the heat, or they're scratching at their elbows, scratching at their knees. So this is becoming heated. So anything that exerts them, but also in a hot bath tends to aggravate them, becoming heated in their bed. So any heat tends to aggravate them. Also, you tend to find in sulfur individuals, they tend to often get eczema in places where they sweat or perspire a lot. So the groin area is a common location, under the arms is quite a common location, under the breasts. So typical areas of lots of perspiration. So Serinum and sulfur look very similar in that they both tend to be aggravated by getting hot or being exposed to heat. But interestingly, sulfur's skin, where Serinum was better by having kind of like a warm compress put onto the skin, sulfur feels better for a cool compress. It's like the coolness takes away some of the heat. So sulfur is a lot more hot, there's a lot more inflammation or marked inflammation in sulfur than there is in the Serinum. The Serinum, they get very itchy and you see the excoriations, but you don't quite see the the severity, the intensity of the heat in the tissue than what you do in sulfur. Often I find with sulfur, children and even adults, as you kind of approach your hand to touching their skin where the eczema is, you don't even have to touch the skin. You can kind of feel the heat radiating from the eczema. So that generally is a good indicator of sulfur. All right, the next one for eczema is rust tox. Now, rust tox is poison ivy. And so if you've ever encountered or brushed up against a bit of poison ivy, you get this incredible itching and burning. And very often, if it's quite a severe contact, you get little kind of tiny fluid-filled vesicles. And interestingly, this is what rust tox looks like. So rust tox eczema eruptions, they often get kind of fluid-filled vesicles that they scratch and scratch and scratch, that are very itchy. And once the vesicle pops, there's this kind of watery, clear discharge that leaves the vesicle. Rust tox generally tends to be worse in the morning, so they tend to wake up early in the morning with lots of itching. So they fall asleep fine, and they sleep through the night fine. It's just in the morning on waking that they tend to aggravate. They also are worse with cold. So you often find that rust tox, their eczema tends to be worse when the outside environment is quite cool and quite damp. And also, again, they don't kind of like moisture on their skin. You may sometimes find too with rust tox eczema, also manifestations of kind of joint pain. And emotionally, you may find a fair degree of kind of irritability or restlessness with the eczema. NATMO, very similar to rust tox, tends to have also vesicular type eruptions, but not always. So if they don't have vesicle eruptions, NATMO then tends to be more on the kind of dry, flaky side. NATMO, interestingly, is table salt. And so if you've ever been into the ocean and you go for a swim and you come out the ocean and then you kind of sunbathe for a moment, and when you look at your skin once you've dried, you get all these kind of little flakes of salt on your skin. Try and imagine that's what the NATMO type eczema looks like. It's very dry, like kind of parchment paper, with lots of little kind of white flecks and flakes on the skin. NATMO also tend to be worse with the heat, worse with the sun. So very similar in that sense to the sulfur, but you don't see as much redness as you see with the sulfur. And in sulfur, there's a lot more heat involved. With NATMO, we don't get the same effect. Also, bathing in the sea, which is quite interesting because many eczemas tend to get better or feel better with sea bathing, but this is the peculiar one with NATMO. NATMO doesn't feel better with sea bathing. You also tend to find the eczema eruptions in NATMO tend to happen along the hair margins, and actually they also get kind of little pimples along the hair margins, and then eczema in between the fingers, so in between the grooves. The next one is graphites. Now, graphites is one that I see a lot, particularly not just with eczema, also with psoriasis, actually. And that's because of the kind of yellow honey-like discharge that we see developing in these eczemas. So these patients, more often than not, have quite thick eczemas, and they tend to be quite thick and moist, and very often ooze this kind of very sticky yellow discharge, and that discharge then dries over the eczema and becomes these kind of little yellow flakes. So that's quite a typical graphites presentation. What does happen with graphites is that it becomes hard, it becomes quite thick, and as a result of this, if the graphites develops around the knuckle areas and then the folds of the skin, obviously it then tends to kind of crack and fissure and get infected. Unfortunately. You also see that with graphites, a very typical location for both psoriasis and eczema tend to be either both in the ear canals itself or behind the ears. So these are very common locations for graphites. All right, and then the last one is petroleum. And I put petroleum in here because if we think of how we manage eczema, particularly from an allopathic stance, is very often using emollients like oleatum, using some people use Vaseline, things like pseudocreme, A lot of these products, which ironically are petroleum-based products. And unfortunately, petroleum, because it disrupts the body's own kind of oil production, um, it ends up actually causing more dehydration to the skin barrier than what it is beneficial. So in homeopathy, we use petroleum, particularly in those patients that have been quite addicted to using a lot of these petroleum-based products. And sometimes you find that these are individuals too that are perhaps maybe via their profession or also exposed to a lot of petroleum-based products. You see these sometimes in mechanics, sometimes in people who, like hairdressers, who are using kind of like a lot of hair products and getting eczemas as a result of that exposure. And so what happens to the skin? It gets incredibly dry to the point where, you know, you're just moving their hands, cracks the skin, it fissures, it looks really unhealthy, they get infected really easily. You often find that it's kind of deep fissuring, particularly around the fingertips. And the nails can sometimes kind of go a yellow color. But the severity in dryness and just desiccation of the skin is phenomenal. So yeah, so do think about it in situations where, you know, maybe patients have been exposed to a lot of petroleum-based products, or perhaps, you know, professionally they're getting very dry hands, very cracked hands, you know, mechanics, hairdressers, people who work with machinery and oils in with machinery. All right, so that's generally my top 6, I would say, for remedies for eczema. But of course, I mean, there are a huge number of eczema remedies. So what I would say is that if none of these are kind of matching your description, most certainly you know, give one of the homeopathic pharmacies a call and you can discuss it with them, or make an appointment to see a qualified homeopath, because they could most certainly better advise you on a remedy that would be more suited to your type of eczema. All right, so just to give you a bit of a visual, so you can kind of understand how they look slightly different. So with the Serenum one, you often see it kind of around the hands and wrist areas. It's quite dry. You see the little excoriation marks, in other words, where they've kind of scratched and broken the skin. The skin generally looks relatively dirty, which is quite common for psoriasis, but key here is this kind of little spot, 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 spot. It's a very typical psoriasis appearance. With sulfur, very common location is the backs of the knees. So remember, with eczemas, you often find along the kind of flexor surfaces, so the fronts of the elbows, behind the knees, and obviously along the wrist and hand areas. But if you can, hopefully you can get a sense of the inflammation, the heat, and the redness around these areas. And you can kind of see the yellowing of the scabs, so propensity for infection. So that's a very typical kind of sulfur type presentation. With this one, you see almost kind of like a bullous type eczema, where they produce these lovely little kind of bulla or pemphigoid eczema, although this is not pemphigoid. But when they get these lovely little vesicles here, this could be a scenario where something like rust tox would be really handy. Yeah, and this is quite a common one that you see with latex reactions. All right, and over here, I'm sure many of you have probably seen patients developing eczema around the eyes. Very, very common location for eczema, atopic eczema. And so now you can see the little speckles, yeah, the little flakes that the individuals developed, and how the dryness of the skin is creating lots and lots of lines. Yeah, very typical with NAPMO too. All right, and then graphites, which is the beautiful kind of indicator behind the ear. And sometimes you may see it extending into the ear canal itself, down the outer pinna, but all the way behind the ear. And you see these lovely kind of big yellow flakes, very typical of a graphites type eczema or psoriasis. All right, and then the last one I mentioned to you, which was petroleum. You can kind of see the severity and the fissuring, yes, of the skin. Very dry, deep fissuring, deep cracks. Okay, and when you have a look at the skin, I mean, the rest of the skin looks pretty healthy. But in the areas where the fissuring is occurring, the skin looks unhealthy. You can see a kind of yellow tinge that forms along each of the fissures. It's very typical of petroleum. All right, so ideally, I would always recommend patients completely avoid petroleum-based products. There's lots of kind of soothing creams that are not going to be suppressive in any way, but just kind of help hydrate and create that kind of physical barrier while the body kind of regenerates from within. So Weleda Skin Food is fantastic. There's another product called Mother Dirt, which works on kind of trying to establish the skin microbiome. And I wish I had time to talk about the skin microbiome, but there's so many studies looking at the gut microbiome, which of course is incredibly important. But in saying that, so is the skin microbiome, and it's one that we forget about. And sadly, when people use lots of emollients, and petroleum-based products, what they inadvertently end up doing is disrupting the skin microbiome. And so this creates a kind of repetitive cycle of itch, scratch type situation. All right. From a bathing perspective, if you're finding the individual has quite a lot of patches, the eczema is not just on their hands or just behind or around their eyes or just behind their ears. It's on their legs, it's on their back. Sometimes bathing can be quite soothing. So I find either things like Himalayan salts or Epsom salts can be quite useful and quite soothing. Weleda also do a lovely calendula bath cream, which I think is fantastic for infants particularly. And then something simple, it's cheap, something like oatmeal, which is incredibly soothing to skin that's quite inflamed. And in fact, I mean, we even recommend that to things like in situations like chickenpox, for example. And then another thing that you could consider, which to be fair is equally done in allopathic circles, but we can do it with herbs and, in a naturopathic setting too, is suggest, parents put scratch gloves on kiddies. Obviously in an adult, you have a little bit more kind of self-control, whereas in infants and children, it's a lot more difficult to kind of restrict their scratching, particularly in the middle of the night when they're sleeping. So a kind of good practice is to try and encourage scratch gloves that will limit the amount of excoriation. Because the biggest concern with children particularly are them picking up secondary bacterial infections in their skin. And then the next one is wet wraps, which is quite a useful technique to do, particularly if there's been quite a severe flare-up. Now, I normally suggest the Ultra B Exoskin Balm, and the reason why I recommend it is because it's pretty clean. It's a very simple product. It doesn't have an array of loads of different ingredients. It's made of beeswax. It's got a bit of propolis in there, and propolis is a great kind of antibacterial. So if there is any potential kind of deep fissuring that are at risk of becoming infected, the propolis in the exoskin can reduce that bacterial infection from occurring. So generally what I'd recommend is moistening a kind of dressing or bandage in a bit of warm water until it's quite damp. You don't need to soak it, just kind of make it nice and damp. After putting on the a thick layer of the exoskin, so you really need to kind of slap it on nice and thick, because remember that's going to be sitting on the skin through the night. So a nice thick layer of the exoskin balm to cover the whole surface area of the eczema lesion. Then wrap the moist dressing around the affected part. Once that's been kind of wrapped and secured, then take a dry wrapping and wrap that over the wet one. That just reduces the kind of dampness from moving out towards the clothing. And from there, then get dressed as normal with your normal clothing over the bandage. Ideally, if you can sleep through the night with that bandage, in some cases, I sometimes recommend patients not take it off first thing in the morning, rather just leave it on through the rest of the day and take it off the next evening, and then change it over to another dressing if need be. But sometimes just doing this wet wrap can just encourage a bit of a body reset, because as I mentioned earlier, if a bit of a itch scratch cycle has developed, that can be quite difficult to kind of stop. The issue is every time an individual scratches the area, what they're doing is they're breaking the tissue barrier, which is initiating the mast cells to release histamine. And when those mast cells release histamine, as I explained earlier, they're having a surge of inflammation, which causes then more itching. So the more they scratch, the more they'll itch. And the more they itch, the more they scratch. So it's a bit of a vicious cycle. And so doing these wet wraps not only give a nice kind of good dose of hydration to the tissue and relieve the symptoms, they can reset the healing process. So these have saved many a patient in the past. All right, and then a couple of remedies for hay fever. And so here we've got the first one is allium, and allium is onion. And if anyone's ever chopped an onion, you'll notice obviously the symptoms that you get when you chop an onion. You get the watery nose, the watery eyes, and the kind of burning sensation that comes with it. And so allium is probably one of the ones that we use quite a lot with hay fever, particularly where hay fever develops this kind of coryza with a very kind of acrid nasal discharge where it kind of excoriates or makes the nostrils kind of really red and burnt. And you often find also like after, even after a day of starting the hay fever, not only is the tip of the nose and the nostrils red, but so is the top lip. It's a very typical allium indicator. And these are situations where, you just lean your hair forward and it feels like someone's turned on a tap. It's just like profusely running with this clear watery fluid. They'll also have profuse lacrimation, so lots of, watery discharge from the eyes. They may also have or experience a kind of sensation of fullness or obstruction, particularly in the root of the nose, so very far back in the nose, despite the fact that their nose is running. You may get lots of sneezing with it. They tend to be worse late in the afternoon, early evening. They're most certainly worse also for a warm room. So, they tend to be better when they walk outside in fresh air, particularly if the air is nice and cool. That tends to provide a bit of relief for them. The next remedy is euphrasia. So euphrasia, you may recall me mentioning this under the herb category. So in this situation, it's not given as a herbal tincture. Here we're talking about it being given as a homeopathic potency. And so with euphrasia, we get lots of eye inflammation. So the rim of the eye tends to be bright red. It's very itchy, burning. It's really unpleasant. It waters. There'd be things like even light is too irritant to the eye. So quite contrary to allium, where allium is better being outside, euphrasia doesn't want to be outside. So any kind of slight breeze tends to kind of exacerbate their symptoms, particularly the symptoms that are affecting their eyes. They may also develop a constant kind of tickle in their throat. So it's not that they don't have a chesty cough or anything like that, but they have this constant kind of feeling that they need to clear something from their throat. Okay, and the next one is Sabadilla. Now, Sabadilla has these kind of sneezing attacks. Now, anyone who's ever experienced hay fever, where you get these paroxysms of sneezing, so you seem to kind of sneeze 20 times, and you think, is this ever going to stop? So they have these lots and lots of sneezing spells, and then it'll be a pause period for an hour or two, and then have another sneezing spell. They also tend to have lots and lots of itching. So itching in the ears, itching up the nose, and a kind of tingling sensation. So if they're not scratching the itch, it'll tingle, almost like calling them to keep scratching. Also, they'll have lots of watery eyes, the burning, the redness, very typical kind of hay fever presentation. Sabadilla tends to kind of favor the left-hand side. So you tend to find the throat tends to be more sore on the left-hand side. And actually, if you have a look at their tonsils, their tonsil on the left-hand side tends to be more kind of swollen or inflamed. All right, and then the next one is Aurelia. Now, Aurelia tends to produce, very similar to allium, this kind of acrid, watery coryza. But what makes them different to the allium is they're actually worse for being outside. They're worse for being in any kind of breeze or draft. So where allium would like, if they're in bed at night, they'd want all the windows open to get a kind of fresh through breeze, whereas Aurelia would be shutting all the windows and making sure there's no draft. And if anything, they'll pick up any subtle draft coming through from under the door that tends to kind of set off their coryza. Unfortunately, with Aurelia, it tends to kind of, most colds or hay fever progresses quite quickly to the chest. So these individuals very often also get additional kind of asthmatic type symptoms. So they'll get the hay fever coryza, and then within a day or two, it will develop into like a chesty wheeze type presentation. Then the next one is Arundo. Arundo also gets itchy nose. So you see it, all the typical indications of itchiness, itchy nose, whereas Arundo gets also the itchy palate. So itchy nose and itchy palate. Salivation during coryza, which is a kind of peculiar indication. But one of their most marked, strongest features for Arundo is this constant feeling that they're going to suffocate. So they've really struggled to sleep at night because of the hay fever. And the reason for that is that when lying down, they have this constant sensation that they're not going to be able to breathe, that the hay fever will eventually suffocate them in their sleep. All right, and then the last one is Wyethia. And Wyethia is one of the most extreme hay fever remedies. There is incredible itchiness. And I'm talking kind of itchiness in the ear, the eyes, in the nose, on the palate, down the throat. It's incredibly uncomfortable and with no kind of respite. It's just persistent. They may get a kind of marked sensation of dryness within the mouth, so along with the itching, whereas Arundo will produce lots of saliva with their extensive itching. Wyethia more has a sensation of they're not producing saliva, so they feel thirsty, and again, also kind of constant clearing of the throat. Now, when it comes to the hay fevers, there's quite a few products out there that one could try instead of the antihistamine nasal sprays. Now, what I would recommend again is applying the no-sode therapy. So if you recall earlier on, I mentioned doing the desensitization therapy. So if you know what allergen you're responsive to, so whether it's Timothy grass or whether it's willow, or have a look, yellow dark, have a look at what your allergy is towards, and then obviously get that no-sode for that and start dosing it weekly in the beginning. You can also add in things like quercetin and vitamin C at least a month before you suspect you're going to start aggravating. But from a nasal spray perspective, it's always ideal to try and get individuals off the pattern or habit of antihistamine nasal sprays. And the reason why I say this is that very often patients develop a state where they become quite addicted to the antihistamine nasal sprays. And in this, they develop a condition called rebound congestion. So the moment they don't use the nasal spray, their sinuses feel swollen and congested, and they think it's because their symptoms are present. Meanwhile, it's the body, it's essentially that kind of like the body asking for more. The body builds up a tolerance to the antihistamine. And this can sometimes be quite a significant challenge to try and kind of get them off of the antihistamine nasal sprays if they've been on them for quite some time. And you see this also with the corticosteroid nasal sprays. So Lufa or Lufil nasal spray can be quite useful to, and you can do spray in each nostril up to every 3 to 4 hours, as and when you have symptoms. The Weleda Rhinodora nasal spray is not so much for allergies, but it does have really soothing aloe vera saline spray. So it's quite soothing, it's non-addictive, and this is a great one for children actually, because it's not going to burn or sting in any way, and it doesn't have anything that they can, cause disrupted immune regulation. It's kind of like a good nasal wash if you're wanting to kind of ensure, mucus doesn't kind of dry up and become tenacious, to kind of keep it flowing. Saline nasal sprays are fantastic, again, just to keep the mucus flowing. I often find individuals end up with complications of chronic sinusitis issues when the mucus has kind of become stagnant and tenacious. We really want to kind of keep it flowing and keep it draining adequately. And then the last option that you could possibly try is something like Haymax. And Haymax is just a little balm that individuals can add or apply to the end of their nose or along the margin of their nostrils. And how the mechanism is supposed to work is it acts to bind or attach or stick to the pollens. And so thus reducing the amount of pollens that are actually going into the nasal cavity, and thus then reducing the severity of the reaction. So a lot of people find that really successful too. All right, and then let's look at some remedies for asthma. So aconite is not one that is typically used for chronic ongoing asthma, but I most certainly find it's a useful one to have on hand when people get episodic asthmatic attacks, particularly if they come on from, unusual exposure to cold, or if they come on from anxiety or stress responses. So aconite, you generally find that these little ones, particularly with kiddies, they'll be playing outside in the evening, and the moment the sun starts setting and you get this drop in temperature, kiddie will come inside and already you can hear them kind of rasping. It sounds very kind of croupy, kind of dry, barking type cough, or their voice sounds very kind of raspy. You often find also these kiddies, they'll be the ones to, they get an earache from being outside in the cold, or get a sore throat from being outside in the cold. And it comes on very quickly. What's most marked about the aconite state is that one moment they're fine, and next moment they've got this croupy barking cough that seems to have come out of nowhere. So that's a great one to have on hand. If you don't hop onto the aconite quick enough, it can progress into an arsenicum state. So in these patients that develop asthma, and they get this kind of intense oppression in the chest. So they'll feel like they can't take a deep enough breath, like they're not quite able to fill the lungs. And in addition to that, you can hear this kind of inspiratory wheeze. They may feel like they need to cough something out, but there's very limited expectoration. And you often find these individuals, they'll go to sleep fine, and they'll wake up between the kind of window of midnight to 2 a.m. With an asthmatic attack, or children kind of coughing between the periods of 12 to 2 a.m. They tend to be relieved by warm drinks, so often kind of sipping on hot drinks tends to, one, calm their anxiety around the chest depression, but also just helps kind of soothe the airways to a degree. You often find these individuals also feel really cold, so when they're having their asthmatic attack, they'll say, "Oh, it feels like my breath is cold, I'm freezing," and they can get themselves into a kind of state of panic, particularly in children. Yeah. And despite them feeling quite chilly, very often in their state of anxiety, you may find them starting to perspire quite a lot. All right, and then we've got ant-tart, or Antimonium tartaricum. Now, this one I use so incredibly often, particularly in cases where you end up with that kind of bronchial asthma that's very incredibly rattly. You can hear that there's mounds of mucus that needs to come up, but they cough, 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 and just it's unproductive. Nothing seems to want to come out. And this is because the mucus that they're holding within their bronchi is very sticky. When they do finally expectorate, it tends to be kind of yellow and thick and tenacious. So it often also takes quite a lot of effort to get any mucus out. And as a result of that, you very often find they develop these kind of coughing fits where they vomit with the coughing spell. Lots of wheezing at night, sometimes wheezing throughout the day, but it tends to then get worse again through the night with lots of coughing when they're sleeping. Medarinum is a remedy that's used quite a lot, particularly again with family histories of allergies, particularly family histories of asthma. So you find Medarinum's asthma tends to flare up just after the arsenicum asthma. So arsenicums are waking up or having their asthmatic attacks between midnight and 2, whereas metarhinum is around about 2. They tend to be worse when we've just had a rainfall. So if it's been damp, um, if they've had lots of sweets that day, you see this a lot with kiddies, particularly now around Easter time or around birthday parties after weekends. If they've had lots of sweets and sugars, this tends to kind of flare up the asthmatic attack. And metarhinum tends to feel better at the seaside. So you'll find these individuals will say that their chest always tends to clear up the moment they go to the sea. Once they return home or if they go inland, their asthma comes back. So it's quite typical. And if they are expectorating, and they do tend to kind of bring up quite copious amounts of sputum, it tends to be quite thick and greenish. It's not sticky like the ant tart mucus. Ant tart is quite sticky and ropey, whereas metarhinum tends to be quite kind of thick and gloopy and green. And you often find also they get kind of, copious amounts of green snot from their nose as well as what they cough up. And then we have phosphorus. Phosphorus, with these individuals, you see with kiddies actually, where the mum will say, my gosh, every time he gets a cold, it goes straight to his chest, right? So phosphorus is very typical of when they get a cold, it goes straight to the chest, normally within 24 to 48 hours. Phosphorus tends to be worse in the morning, so they tend to cough quite a lot in the morning, get very wheezy in the morning. They may have aggravations at about 10 at night. They tend to also be worse when they lie on their left-hand side. So they may say, I can only sleep on my right-hand side. It seems to be the only way that I can breathe. And really with phosphorus, anything can kind of trigger a coughing attack, with their asthma. So it could be things like talking or laughing, deep breathing, eating, even drinking tends to flare up, and not necessarily an asthma attack, but like the coughing spell with the kind of wheeze and raspy breath. And then the last one, spongia. Spongia, a good way to remember this is spongia has this sensation or feeling that they're breathing through a sponge. And if you can kind of imagine what that feels like you're not quite taking in enough breath. So spongia you use quite a lot with children's asthma, and you see them kind of developing a kind of slight blue tinge to the lips. And this is showing us that they're not taking in enough oxygen. They tend to really kind of flare up at night, very similarly to arsenicum, but arsenicum doesn't go blue as quickly as spongia does. Spongia is very dry, kind of hacking cough. There's no expectoration at all. They'll wake up around normally about midnight to 1 o'clock. They tend to be triggered by cold winds, so very similar to aconite in that regard. All right, and then of course the last type of atopy really is the most extreme scenario, which is your anaphylaxis. Now, it's important to acknowledge here, an anaphylaxis is always a medical emergency. This is not within the remit for a homeopath to treat. However, there are still things that one could have on hand that may help aid the individual while they're waiting for that medical attention or medical help to arrive. So it's always very important, if you suspect someone is having an anaphylactic event or reaction, to call 999. In addition to that, while you're waiting to receive help, look on the individual and see if they have a medical bracelet. Very often, if they've had a medical bracelet, it means that they've had an anaphylactic event before, and they're likely to have an EpiPen on them. So whether it's in their pockets or in their handbags. And this is important because that EpiPen would save their life. There's no amount of homeopathy that's going to save their life in that spot. Although I'm going to show you a case in a moment that has done just that. It has saved someone's life, but I'd prefer us not state that we rely on homeopathy to do so. You really need to make sure that if they have an EpiPen on hand, to utilize it. There's nothing wrong with taking the homeopathy alongside the EpiPen if you've managed to find one. And so generally my anaphylaxis kind of complex that I would suggest to people to have, and actually, in fact, I think every parent should have this in a first aid kit. I have one in my car, although thankfully my kids are not allergy constitutions. However, this combination works fantastically for both anaphylaxis, but also for jellyfish stings, wasp stings, bee stings, any time where we have this kind of surge in inflammation. So this allergy complex has histaminum 200C, Apis mellifica 200C, and urticurans 200C. Now, these, if you contact the homeopathic pharmacies, which I mentioned a little bit later on, if you contact them, you can ask them to include all three of these items in one complex. So it's nice and easy for you to take. And so in these events, you'd be taking 3 pills every 5 minutes until the symptoms start subsiding. And so on ending, I just want to talk about a little case example of this little patient F, who at the time of me seeing him, I started treating him when he was 4 years old. He has an extensive family history with lots and lots of allergies, mostly hay fever and asthma allergies. Unfortunately, he developed quite severe allergies via producing anaphylaxis. So he was anaphylactically allergic to dairy and eggs. He had 3 episodes historically, and he has to have an EpiPen on hand for the rest of his life. From a blood analysis perspective, he has persistently elevated eosinophils and IgEs. Now, both eosinophils and IgEs, these are markers that we use to kind of measure the degree of atopy or allergic predisposition in an individual. So the higher the levels of eosinophils and IgE, the more active the allergy response is. Now, he doesn't use chronic antihistamines. And the reason for this is because his mum, he's been treated by a homeopath since he was very little, virtually since he was born. But his mum brought him to see me because she wanted more kind of naturopathic stance on things. She wanted a bit of dietary intervention, herbs, homeopathy. She wanted a more kind of comprehensive management. So at the time of seeing him, he would, when he had his warning signs or near to anaphylaxis events, he would develop, you can see around his eyes here, he would develop puffiness and redness around his eyes. You would see swelling around the mouth area. You can see the cheeks, the chin became red. Now, the swelling that you see in the lips here, this condition is called angioedema. So angio means blood vessel, and edema is for swelling. Now, what would happen is he would develop this inflammation and swelling of the blood vessels in the lips. But what we're not seeing here is the swelling that would occur down his airways. Okay, so this is the kind of start of how he would progress into a full-blown anaphylaxis. Now, with treating him for 2 years, under homeopathic management and of course also dietary intervention, he had not had, in those 2 years, he had not had any anaphylactic episode until his family went on holiday. Now, because he hadn't had any episodes for 2 years, his family, as many families do, had become a little bit complacent. And so they had gone for dinner to a restaurant. And while sitting at the restaurant, his father offered him a piece of shrimp from a salad. Now, he had not had shrimp before, and his parents, not realizing that shrimp is a very common food allergen, they gave it to him, and he proceeded to start his anaphylactic reaction. Now, as I've said, his parents had become complacent, so they didn't have his EpiPen with them. Unfortunately, they had left his EpiPen at the hotel, which was 2 blocks away from the restaurant that they were sitting at. So at that point, the dad shot off to run back to the restaurant to go and get the EpiPen. His mother had remembered that she had this antihistamine complex, the complex I mentioned to you a moment ago, which has histaminum, it has Apis mellifica and urticurans. So because I told her to keep this complex with her in her bag forever, yeah. And the beautiful thing about homeopathy is it really actually doesn't expire. Yeah, although we have to put an expiry date on it because it's an energetic medicine, it doesn't expire. So she still had it at the bottom of her bag. So she thought, well, she's got nothing to lose while she's waiting for her husband to bring the EpiPen, and they were calling the ambulance, and just in case, she started administering the antihistamine complex every 5 minutes. After the second dose, she started observing that the swelling in his lips started going down. And by the time the dad arrived after 15 minutes, the EpiPen was no longer needed. He was coming out of the anaphylaxis episode. So this is remarkable. Needless to say, although this mum had been using homeopathy for years, also for her two older children, I think this was the point in her homeopathic experience that she realized just how remarkable homeopathy was. She continued to give him a few more doses just to ensure that he came out of the anaphylaxis completely before stopping. And he's now 8 years old and hasn't had another anaphylactic response since then. So what we've been working with him is more on a constitutional level to kind of down regulate his hypersensitivity. And so really, hopefully long term, he should not have anaphylactic episodes. And if he does, he should be able to recover from them pretty promptly. What we do see happening with him now, because his body's now pushed it more superficially, he gets these mild kind of urticarial reactions. Yeah. I mean, in saying that, he hasn't had an urticarial reaction for over a year. But this was the last urticarial reaction that you could see. You can see the kind of little wheels around his tissue. Yeah. Or around his face, yeah, around his eyes, around his mouth. Now, you can see a very mild swelling, a mild urticarial reaction on the lower lip, but the top lip is fine. It doesn't progress any further from that. And this one here, with the urticarial reaction, he took the antihistamine complex 2, but he only needed to take it every 15 minutes for 4 doses, and the urticaria reaction subsided. So there's a lot one can do with using homeopathy in allergies. And I'd highly recommend, if you're concerned or have more severe conditions like anaphylaxis, um, absolutely get in touch with a homeopath, because they'll be able to advise you on how best to take the homeopathy and how best to have an action plan in place in events like this. All right, so there's a variety of homeopathic pharmacies, particularly in the UK. We've got Helios Pharmacy, Ainsworth Pharmacy, Nelson's Pharmacy. But as I've said, there's a lot of 30C potencies which are pretty readily available in places like Boots, in Holland and Barrett, on Amazon, and then of course in other countries like the US. Boiron is a great homeopathic supplier. So there's lots of possibilities. Homeopathy is incredibly accessible. Thankfully, in the UK, if you phone Helios Pharmacy or Ainsworth Pharmacy, they do have a helpline where they can advise you very simplistically. But of course, for more kind of detailed chronic cases, you would have to see a homeopath. All right, and so if you're listening in on this, considering broadening your scope of understanding, I just want to say to you, in the UK and really globally, we need more therapists out there. I say to my students all the time, we've got more than enough sick people to go around, unfortunately. So we need to have more homeopathic practitioners. We need to have more naturopathic practitioners out there helping the masses and educating individuals on how they can empower themselves to really heal and repair and to manage their conditions more effectively than just medicating with pharmaceutical drugs. So do visit our website at www.naturopathy-uk.com, or give one of our course consultants a call on 013 424 10505. They're happy to chat about any of the courses that we have on hand. And do follow us on our CNM Facebook page. It's at cnm.uk, or on our Instagram page at College of Naturopathic Medicine. We always have loads of different posts on recipes, top tips on health, and loads of different courses and seminars that we're running through the year. And hopefully I get to meet you soon. So thank you for listening, and take care.
I'd lasted about 3 months at uni, trying to be a dancer and do English and do all the right things, but it wasn't actually my passion. And I heard about CNM, so I went to an open evening, and Charlotte Gerson from the Gerson Therapy was there. And oh my gosh, she was just amazing. She blew me away with some of the things that she was saying about how the body could actually heal itself. And I signed up for a 5-year course that very day and absolutely loved it. I just kept learning from then on in because CNM offered so many good courses. And as soon as I qualified, I thought, now's the time to do something with this. So literally within 6 months, I'd been able to set up practice. I personally employ CNM students or CNM graduates. We have 5 CNM graduates here in different capacities, like as a nutritionist or an advisor within the shop, or even as a herbalist. The knowledge that they have is absolutely amazing, and I can trust them. I can really trust them with my clients. I've built up a business over the past 18 years, and that reputation is everything to me. So knowing that the CNM graduates have the right knowledge and also have the confidence to speak with my clients is great. I have no qualms about bringing on students because I know how good they are.
But I was looking to finish my old job, and I wanted to put myself in an environment where I was surrounded by herbs or nutrition or that kind of thing. Because I knew if I didn't make the switch, I'd probably just carry on doing my old job and not giving it up because of the money, basically. So yeah, and Gabby was looking for someone, so that's when I made that switch about 1.5 years ago.
I've now been lecturing for the CNM for about 6 years, and I lecture across the board as in the nutrition field, naturopathic field, and for the herbalism as well. And I love it. I think the lectures are so well structured. I love the information on the slides. I love the fact that it really brings it together quite cohesively for a student when they're then writing assignments about it. My husband often says to me, "You're so lucky that you love your job," and it's true, because if I won the lottery, I know full well nothing would change. I love what I do, and when clients are sitting with me, they actually say, "I can feel your passion, you love what you do, don't you?" I say, "I love it."
My name is Melissa Cahill and I studied nutrition with CNM in Cork. So my favourite part about the course in CNM was the clinics. I found it really gave me the confidence that I needed to actually go out and practice on my own afterwards. I think without that I probably wouldn't have gone straight into my own practice. So after I graduate, I've opened my own clinic, so Nona Nutrition, and I plan on specialising in women's health and pregnancy nutrition. I always had an interest in nutrition, and I was always doing small nutrition courses, but then when I found CNM, I just knew it was the college for me, and I was working in a health store at the time, so it just kind of went hand in hand for me to do it. So CNM has changed both mine and my family's life, because I now have the knowledge to support us health-wise, and it's given me the opportunity to become self-employed and to work my hours around my family and my clinic as well. I would recommend the course to someone else. I think if you've an interest in nutrition, it's definitely the course for you. The content is fantastic. The clinics give you the confidence that you need to go out and be a successful practitioner.